Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. It's a fact of veterinary medicine. Sometimes taking care of the animals we love can be expensive. Meeting our patients' owners where they are and customizing a plan that makes sense for them ensures that more animals get access to the care that they need. Today, we're talking to Dr. Peter C. Hann. He earned his Doctor of Veterinary Medicine degree from Colorado State University in 1982, then worked for many decades as a practice owner specializing in companion animal medicine and surgery. And since 2024, Dr. Hann has been the companion animal technical services veterinarian at Aurora Pharmaceutical. He's a specialist in parasitology, and he shares his expertise with veterinarians across the United States. Dr. Hann, thank you so much for joining me.
Well, thank you for having me. I'm flattered and very appreciative that you saw fit to do that.
Absolutely, absolutely. And this is such an important topic. I think it's topical and timely. And so let's get into it. Let's talk about generic pharmaceuticals. Specifically some terminology like biowaiver. What are we talking about and how do these terms apply to generic medication?
Well, I think this is an important topic to address because I think almost every veterinarian utilizes generic drugs to some degree, at least in their practice, but they may not be aware of some of the finer details regarding the FDA scrutiny of generic drugs or the rules that govern generics. So I think, as everybody in the audience knows, the FDA is tasked, among other things, with approving drugs that are both safe and effective. And this is true of generic drugs as well. Generics must meet the same or at least certain standards of safety and efficacy per these FDA guidelines. Now, the primary reason generic drugs are less expensive is that the companies that make them do not have the drug research and development costs that are associated with bringing a new drug to the market. So these companies that do bring new drugs to the market have these R&D costs and pass them on to consumers, and they have a patent on their drug, which makes it illegal for anyone to copy that drug for a certain period of time. And this allows them to recoup these R&D costs that they have incurred. Now, when the patent expires, it becomes legal for other companies to copy that drug and manufacture it, and they can provide less expensive version of the drug. But as we mentioned, all of these generics still have to be approved by the FDA. Now, to your question regarding biowaivers, broadly speaking, when a generic drug is granted a biowaiver by the FDA, it means that the FDA has determined that that generic has either met or exceeded its formulation standards regarding its similarity to the pioneer drug. And so effectively, more specifically, I guess what it means is that this biowaiver means that the generic company does not have to prove the safety and efficacy of its drug by the use of clinical trials. So in essence, the FDA has said, hey, we recognize this drug is identical to the pioneer drug, and consumers can therefore be comfortable and confident with this.
The question is always, can we trust generic drugs? But it sounds like if the FDA is having to ensure that these truly are the same drug and the same formulation, that, I can't imagine there being much of a difference in terms of whether or not we could trust a generic equivalent.
Well, yeah, that's exactly right. That's absolutely true. Now, generic equivalent drugs are deemed by the FDA to be equivalent to the pioneer drug. So they're the same. And so we can have the same expectations of efficacy and safety for that. Now, it is important to keep in mind that not all generics are generic equivalents. And so the practitioner needs to keep that in mind and pay close attention when they're choosing to use generics.
So what would be the difference between a generic and a generic equivalent?
Well, a generic equivalent has been shown or deemed by the FDA to be identical for all intents and purposes to the pioneer drug. If the drug is a generic drug but not a generic equivalent, it's very, very similar to the pioneer drug, but it might be slightly different. It might be excreted a little more rapidly, or the peak concentration achieved by the drug might not be as high as the pioneer. But in generic equivalents, it's been shown by the FDA that the generic equivalent is identical to the pioneer product.
Along the lines of talking about generic equivalents, can we talk about barrier? I understand this is a generic equivalent to Advantage Multi.
Yeah, that's absolutely true. Barrier was granted a bio waiver by the FDA and is identical to Advantage Multi, and it has identical label claims. So, as a generic equivalent, it is effectively the same as Advantage Multi, except quite a bit less expensive.
I would imagine that makes a big difference when we're talking about making sure that all of our patients are able to access preventative and be protected against parasites.
Absolutely true. If we can provide more cost-effective options for our clients, obviously it gives them a lot of benefit in that they might be able to afford to do other things in addition to the medication that you dispensed, especially with a generic equivalent where you trust the safety and efficacy of that drug to do what it's supposed to do.
Absolutely. Yeah. And I think that's a really good point that you make of not only saving cost and making the medication accessible, but also potentially opening up funds to be able to do other preventative care or other treatments that we might recommend for that patient.
Absolutely. Absolutely.
Sure. And I understand that Barrier carries a box warning. Can you talk a little bit about that?
Well, yeah, I'd be happy to. It's because this is an important thing for veterinarians to be aware of. So the original drug was Advantage Multi, of course, and the FDA required a box warning to be placed on it because of the high levels of moxidectin that are in the product. And basically, there's the potential that for toxicity, if it's ingested by that small subset of dogs that have this MDR1 mutation, which makes them extremely sensitive to avermectin, the avermectin class of drugs. But what's important to understand is that Barrier is completely safe to use topically, even in known avermectin sensitive individuals. Safety tests were done on known avermectin sensitive collies, in which 3 to 5 times the label, 3 times and 5 times the label concentrations were applied topically at 2 week intervals, not monthly intervals, for 3 months, and there were absolutely no adverse events associated with this. So it's completely safe even in avermectin sensitive individuals as long as it is applied per the label instructions topically. So the other thing that's interesting is that it's got a very bitter taste. And so dogs and cats are really, really unlikely to even want to lick at it. And over the years, almost all of the cases of oral toxicity have been the result of owners mistakenly forcing the pet to take it orally. So I think it's important to know if it is inadvertently ingested by a non-avermectin sensitive pet, it does have the capacity to cause some neurologic side effects, which are dose related. The less the dog or the cat gets into, obviously, the less time. But the important thing to remember about that is that almost every case will resolve over the course of 12 to 24 to 48 hours with good palliative care. Now, unfortunately, in avermectin sensitive individuals, ingestion of as little as even 40% of the dose can be fatal. So the take home on this is use Barrier on the pet, not in the pet.
That is a very easy to remember take home. And yeah, probably doesn't hurt to store it out of reach, although it sounds like pets would be really unlikely to go dig it
There,
out of the cabinet themselves.
Yeah, you're exactly right. They're unlikely to do it. And of course, all over the packaging, we have a message that says do not administer this product orally, even on the individual tubes. So we've done everything we possibly can to ensure that the clients are aware of this.
Sure, sure. And good client education point to have when we're dispensing it. And yeah, then at that point, that I agree with you. It sounds like we've done all that we can and the company has. And it sounds overall that the chances of encountering issues related to this box warning are on the smaller side.
They're very small. I used to work for Bayer Pharmaceutical back when Advantage Multi was launched. Now, we were very concerned about this potential for oral toxicity, and we're quite pleased with the small number of oral ingestions that occurred. And a lot of this had to do with the fact it tastes horrible to these pets, and they're not likely to do it. It was really, as it turned out, worrying about a lot of nothing. Even though the black box is still on there and probably needs to be on there, it really turned out to be a non-issue.
We've talked about Barrier being a generic equivalent to Advantage Multi. Are there any unique aspects to Barrier that we should be aware of?
Well, I think there are actually quite a few. Just like Advantage Multi, it's important for everyone to understand that it is administered topically, and the moxidectin portion of barrier is absorbed transdermally, so it reaches systemic concentrations. Now, this is important because topical administration allows much higher concentrations of moxidectin to be delivered to the pet than oral administration does. Now, oral administration of that much moxidectin would be absorbed so quickly that it would probably result in toxicity. But this is what makes the topical formulation of moxidectin such a great parasiticide. It allows it to be delivered at high concentrations, which have the capacity to kill a much larger spectrum of parasites than the lower concentration oral moxidectin products can. And additionally, moxidectin has a 30-day half-life when it's administered transdermally. So back in the day, Bayer, who was the original manufacturer of Advantage Multi, wanted to develop a broad spectrum heartworm preventive that also had the capacity to effectively deworm pets for intestinal worms, as well as a wide variety of other parasites. And they were very successful in their endeavor to do this. But it required them to deliver the moxidectin at a much higher dose, and therefore it had to be delivered topically. And of course, Barrier shares these characteristics because it's a generic equivalent. And all of this resulted in what I like to call the happy accident. So it's important to understand that it takes about 3 to 5 times as much moxidectin to kill hookworms, ascarids, and whipworms as it does to prevent heartworm disease. And since Barrier has a label for all of these parasites, Barrier contains 3 to 5 times as much moxidectin as is necessary to prevent heartworm disease. So we can do a little math here. If we start with 3 to 5 times as much moxidectin as we need to kill or to prevent heartworm disease, and the half-life of the moxidectin is 30 days, well, 30 days after administration, this means that there is still 1.5 to 2.5 times as much moxidectin as is necessary to prevent heartworm disease. So, in effect, Barrier continues to prevent heartworm disease for 30 days after its administration. So, like other monthly heartworm preventives, it kills anything that the dog or the cat was exposed to, any of the heartworms they were exposed to in the 30 days prior to its administration, but continues to kill any incoming L3s the dog might be exposed to for an additional 30 days. And ultimately, this results in truly 60 days worth of parasite protection. And this actually was shown to be true in a 2017 article published or written by Dr. Dwight Bowman at Cornell University. So I do think it's important, even though we do technically have a 60-day compliance ability or 60 days ability to prevent heartworm disease, it is important for everybody to realize that it needs to be applied at 30-day intervals to ensure that it gets all of the parasites on its label. But providing this little bit of a compliance cushion for clients, I think, has great benefit. Clients are clients. They sometimes forget to give the medication, and Barrier can help with this. One last thing I do want to touch on, because I have gotten a lot of questions about this, is regarding this high level of moxidectin and its long half-life. And the question is, well, gosh, if you keep giving it every month, aren't you going to result or cause toxicity? And the short answer to the question is no, because after 3 to 4 months, the moxidectin in the pet reaches what we call a steady state, where it's being excreted at the same rate at which it's being administered. So it never goes above that steady state. It's approximately twice as high as the dose that we achieve after the initial application. Completely safe, never goes higher than that. But the benefits of having this long-term moxidectin are wonderful, especially with regard to heartworm prevention.
Sure. And I love that you put clients in that bucket, as clients are clients, and sometimes they don't administer prevention on time. I think I could probably lump myself into that category from time to time of, oh, shoot, did I give that? And maybe be a couple days late here and there as well.
Well, I've probably fit into that category of less than 1%. I'm pretty adamant about giving monthly heartworm preventive, but I agree with you. Every once in a blue moon, I will be a day or two late with mine. And we need to have these same expectations for our clients. And barrier provides this cushion that we talked about, at least with regard to heartworm prevention, that really none of the other products in the market have.
And Dr. Han, I feel like you've spoken to this so well up to this point, but let's kind of put a bow on it here. Can you kind of summarize for us why it's so important to have access to generic options, specifically for parasiticides, and then also for other pharmaceuticals?
Well, my personal opinion is that generic options are a really, really inexpensive way for pet parents and, of course, veterinarians to provide very high quality medication for their patients and for the pets at a very low cost. And this is certainly true when the generic is the generic equivalent of the pioneer drug. By saving a lot of money on drugs, these pet parents can afford to provide preventive and treatment care for their pets. And obviously, I think, anyways, providing more options for pet parents allows veterinarians to improve both the quality and the quantity of the care that they provide. And this ultimately leads to an improvement in the quality of life for both the pets and the pet parents.
Dr. Han, this has been a great conversation. Thank you so much for joining me.
Well, thank you so much for having me. I've enjoyed it completely. This is wonderful.
And thank you to Aurora Pharmaceutical for partnering with us for this edition of Vet2Vet. Check out NABC's vetfolio.com for more of our B2B discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.
Barrier for dogs. Caution: federal law restricts this drug to use by or on the order of a licensed veterinarian. Warning: do not administer this product orally. For the first 30 minutes after application, ensure that dogs cannot lick the product from the application sites on themselves or other treated animals. Children should not come in contact with application sites for 2 hours after application. See contraindications, warnings, human warnings, and adverse reactions for more information. Ingestion of this product by dogs may cause serious adverse reactions, including depression, salivation, dilated pupils, incoordination, panting, and generalized muscle tremors. Human exposure to this product has been reported to cause headache, dizziness, and redness, burning, tingling, or numbness of the skin. Barrier for dogs is contraindicated for use on cats. Keep out of reach of children. Barrier for cats. Important safety information. Caution: federal law restricts this drug to use by or on the order of a licensed veterinarian. Warnings: do not use on sick or debilitated cats or ferrets. Do not use on underweight cats. Do not use on cats less than 9 weeks of age and cats or ferrets less than 2 pounds body weight. Precautions: avoid oral ingestion. Human warnings: children should not come in contact with the application site for 30 minutes following application. For complete safety information, refer to the package insert.